Hello and welcome. Today we're going to be talking about the condition frozen shoulder, which is also known as adhesive capsulitis. Today we're just going to be covering what the condition is, which population it can affect, as well as what treatment options are there to manage this condition. Frozen shoulder is a condition that's characterized by pain, stiffness, and a loss of range of movement in that shoulder joint. The limitation in movement affects both active and passive range. This means your movement is restricted at the joint when you try to move your own arm and when someone else, such as a doctor or a physio, tries to move your arm for you. This painful stiffness can cause sleep disturbance, inability to complete daily activities, and impair quality of life. We're sort of seeing that symptoms often begin gradual, worsen over time, and can resolve spontaneously within 12 to 36 months. Frozen shoulder affects the shoulder joint, which is known as the glenohumeral joint. This is made up of the top arm bone, which is called the humerus, where the humerus head meets the end of the scapula, which is also called the glenoid cavity. This joint is known as a flexible ball and socket joint and allows the shoulder to move in sort of flexion, extension, external rotation, internal rotation, and abduction and adduction. Frozen shoulder can restrict all of these movements, but what we're seeing that external rotation is normally the first range to sort of be restricted the most. The joint is enclosed in a layer of connective tissue called the shoulder capsule, which is just this here. In frozen shoulder, we see the capsule to become quite inflamed and scar tissue is being formed. This later thickens and becomes quite tight, which means the shoulder joint becomes restricted and painful. So the frozen shoulder is affecting 3% of the general UK population, with it present between the ages of 45 and 65 years, with the higher prevalence being between 50 and 60 years. It is rarely present in adults aged 40 years and below, and women are more likely to develop the frozen shoulder than men. People who get frozen shoulder on one side can also develop on the other side, with the occurrence of 6 to 17% in patients. There is a higher incidence of frozen shoulder in the diabetic population, and research has shown that patients with diabetes can be up to about 20% higher risk of the onset of frozen shoulder. So there's no exact or clear understanding of what causes this condition, yet many factors are believed to be contributed to the onset. Frozen shoulder often appears as a result of a shoulder injury, such as a rotator cuff tear, or sort of a bone fracture or dislocation affecting that shoulder, as well as any shoulder surgeries people might have had in the past. Frozen shoulder can also happen without a preceding injury and tends to affect people with certain diseases and conditions, such as diabetes, diseases affecting the thyroid gland, even patients that have been immobile for prolonged periods, and patients that have had strokes or have Parkinson's. People who have frozen shoulder often go through three phases of symptoms. The first phase, known as the freezing phase, can last 2 to 9 months and involves diffuse, severe and disabling shoulder pain that worsens at night. During this phase, the shoulder becomes increasingly stiff. And then we move on to the second phase, known as the frozen stage, and this is where we're seeing more stiff symptoms than painful symptoms, and this can last between about 4 to 12 months, and this is where we're sort of seeing that range of movement is becoming quite limited in the joint. And then finally, the third phase, known as the thawing phase, lasts 5 to 24 months, and in this phase we're seeing a gradual regain of range of movement. In most cases, frozen shoulder can get better on its own, even without treatment. However, there are cases which people never regain that full range of movement they've had before. There are a few treatment options for frozen shoulder which can be combined, but there's no obvious course of action that is the right for everyone. Treatment options include non-steroids, anti-inflammatory medication such as ibuprofen. This is to help sort of manage that pain and inflammation. There's also physiotherapy, which can help for guidance of gentle range of movement exercises and stretches for the shoulder joint. And we do often see patients that do develop that early painful symptoms go down the route of a steroid injection into the joint to provide short-term pain relief and increase range of movement. There are people with extreme cases of frozen shoulder who don't improve with other treatments and often undergo surgical intervention to release that shoulder joint. So yeah, we've come to the end of the video. I hope this information has helped you to understand a little bit more around the condition of frozen shoulder. If you or someone you know is presenting with symptoms similar to frozen shoulder, you could send them in the direction of this video. Or if you do feel like you do need some medical advice, don't hesitate to contact the GP or contact us at Kendall Physio on 01539 72 5220 and you can book an appointment with one of our therapists. Alright, take care and thank you for listening.